Aloha and welcome to the Hawaii Public Health Training Hui's February webinar, Hawaii's Prevention Response to the Dangerous Mix of Alcohol and COVID-19. Next slide, please. My name is Stephanie Moyer, and I'm the Community Initiatives and Training Coordinator for the Hawaii Public Health Institute. And other partners are Makamai Namahoi, Hi-Fi's Contracts, Grants, and Operations Assistant, as well as the Hawaii Public Health Training Hui's Steering Committee. Next slide. I'd like to thank our sponsors and partners for today's webinar, the Hawaii Public Health Training Hui, the Western Region Public Health Training Center, and the Public Health Learning Network. Next slide. We have been approved for continuing education credits in 4 areas for CHES, registered dietitians, social work, as well as CSAC. Next slide. Our learning outcomes for today are identify ways COVID has impacted alcohol consumption, explain ways alcohol has become more accessible during COVID, explain how increased availability increases the potential for alcohol-related harms, identify ways in which Hawaii's substance use prevention system has adapted its strategies to prevent and reduce alcohol-related harms, and identify new ways to get involved in prevention strategies to help reduce alcohol harms in the community. Next slide. It's my honor to introduce you to our guest speaker today, Rick Collins. Rick is a Cincinnati, Ohio native who has resided in Hawaii since 2003. He specializes in public health policy on alcohol and other drug use. He is the co-founder of the Hawaii Alcohol Policy Alliance, and he currently serves as coalition director for 3 community coalitions across Hawaii. His experiences include building new community coalitions, community organizing, and implementing community-level policy strategies to reduce the harms of substance use. Rick works as a consultant for the Community Anti-Drug Coalitions of America and provides training and coaching to anti-drug coalitions locally and nationally. He serves as a board member for the U.S. Alcohol Policy Alliance, Hawaii Youth Services Network, and the Hawaii State Juvenile Justice Advisory Council. He is a certified prevention specialist and holds an MS in counseling psychology from Chaminade University and a BA in religious studies from the University of Dayton. Before I turn it over to Rick, I want to go over a few housekeeping rules for Zoom. Please utilize the Q&A box at the bottom of your screen or the chat box for your questions. I will be posting the slides following our presentation in Moodle, so please access those slides if you are interested in downloading them through your Moodle account. And without further ado, I'd like to turn it over to Rick.
Thank you, Steph. Wow, that made me a little nervous because I was hoping I didn't have any typos there in what I sent you. So welcome, everyone. Again, my name is Rick Collins. I'm really excited to be here this afternoon with you and to talk about my favorite topic to talk about at work, which is alcohol. And what it's going to look like, what it looks like because of COVID-19, and what are some things that we can learn about the changing landscape that COVID's created in our community, and more importantly, what's Hawaii doing about it, and what could you be doing about it individually if you so get inspired. So so I actually have way too many outcomes likely because I got really excited when Steph asked me to do this. But I'm going to try to cover everything we have in here, and my plan is to leave some time at the very end for some Q&A. However, I'd also like to encourage you as I'm presenting, because I can't interact with you folks, if you have other resources that you'd like to provide to everyone or comments, please use the chat box for those. I'd like for this to be a collaborative in a way that you can share those resources as we're talking about different topics. If you've got things to share, that would be great. And if, as Steph said, just to kind of go over what Steph was saying and support that, if you could put the questions in the Q&A box, that would be helpful so that I can make sure that we get to those at the end and that I don't have to go through the chat box and find the questions. So with that, let's go ahead and begin. So I just want to start by grounding us in 2 things, and that is that we are talking about, coming from a place of talking about this from as much evidence as we have to support it, We want to take an evidence-based approach to what we're talking about, and we want to find evidence wherever it's possible to support what we're talking about. We get into topics that have emotional charges like alcohol in our community. We can often have our own kind of anecdotal perspective of it. And that's important. I think that oftentimes is the driver that moves us to do something, because we have a personal connection to it, or we think and believe that this might be, there might be root causes that we know of or that we can relate to that are happening in our community. But some of what I might be showing you may be counterintuitive to your own, hopefully not your own experience, but what maybe you've learned. I know when I first sat through a presentation that really changed the trajectory of my career, that made me move into this type of work. I was originally a marriage and family therapist for the first part of my career, was this kind of aha moment that I had. And it was a changing of my paradigm around how I viewed how alcohol interacted with my community. And now how different that is, as I've discovered just the environment in which alcohol is in our community, I guess I'll say, and we'll get to this. So I just kind of want to ground us in that. If what I share doesn't square with your experience or your anecdotes or what you think, that's fine. Feel free to share. But I'm hoping that this gives you a different paradigm and a different lens to look at alcohol in our community. And that really is that I'm going to leave it. It'll be a spoiler alert if I say it. All right. So that's that. The second thing I want to just ground us in is a sense of hope. I think right now, like any other time, for most of us anyways, this is an unprecedented time that none of us have had to experience such kind of trauma in our life related to COVID and the stress of that. And I've got a first grader here, so if he comes through the door, I apologize, but we're all working in this kind of environment, right? But I want to ground us in hope too, that while what I'm going to show you seems dire, and what some of the data that I'm going to show you is probably doesn't look good right now for the health of our community, I hope that by the end of this, you feel like you have a sense of that there are things happening in our community that are trying to improve the situation, trying to reduce alcohol harms. And personally, if you feel moved or excited or interested in this, I just want to encourage you to chat about it, reach out to folks maybe in the chat box who are talking about this stuff, and I make myself available for you. So if at all at the end I've got my information there, feel free to reach out to me as well. But I certainly want us to leave with a sense of hope. All right, so let's talk about alcohol before COVID. And what I want to first lay down as a foundation is just some data on consumption and use rates. And so I want to start kind of at this 30,000 foot level 30,000 foot level discussion about kind of quantitative survey kind of data. What does our community look like in terms of its consumption of alcohol? And I'm really going to start pre-COVID because that's important to know as kind of a baseline of how it is changing between what we experienced from pre-March of 2020 to what we have now. So this graph is a graph that's depicting underage drinking both in Hawaii and as compared to the US. And so this is from the CDC, easy to pull up if you need that information. I'm in a presentation. Your whiteboard. Oh, sorry, everyone. Yeah, can you bring it back when you're done? Here. Oh, you're gonna let me borrow it? Okay. Sorry, he's letting me borrow his school whiteboard. Sorry, everyone. Like I said, good thing I preempted that. All right, so so what was I saying? So this is a slide around underage drinking consumption, both in Hawaii and as compared to the US. And so across the bottom there, I have what those behaviors are. So in that first graph, what you're seeing there on the left is what we would call current underage drinkers. So this is high school data that I pulled, 9th to 12th grade. And these are young people that report past 30-day use. This is also, which I didn't put in there, it's down at the bottom in the results, but it's 2019 data. So we're looking at pre-COVID data in terms of consumption of alcohol by young people. So about what we have is across the state, 20.4% of our high school students, again in 2019, reported current use of alcohol. That's compared to the US. The US is actually higher than us, which is 29.2%. That middle row, that middle graph that I have there, chart is binge drinking. And so binge drinking is, I believe it's defined as 4 to 5 drinks in a couple of hour period. So binge drinking is probably one of the most important indicators that we use in terms of consumption because it's the most dangerous. Binge drinking is going to have a lot more consequences that can be associated with it, as opposed to maybe a young person who was at a family barbecue and they had a beer or two once that month, but they were reported current drinking, but maybe they weren't binge drinking. So binge drinking has already kind of built into it a lot more risk in our community. So we see, again, we're at about 10.9% across our entire high school population as compared to the US, which is at 13.7. And then drinking before the age of 13. This is also a good indicator to follow, because we know that the earlier that young people initiate drinking alcohol, the more likely they are to have use and addiction problems later on in life. And the more likely that they're just, I think that they're likely to have negative health outcomes in general. So this is just an indicator we want to see. And of course, from a prevention perspective, what we really want to be doing is lowering young people in our community that are drinking currently. We certainly want to lower binge drinking. And so a lot of our prevention strategies try to target those settings where binge drinking is occurring. And then obviously on the drinking before 13 data point, we really want to be raising that up. We want to see young people initiating drinking later on in life. We want to delay that. So I just wanted to break down binge drinking so that you could see this from a perspective of the county and the state. So this is from the, I don't think I have a source here, but it's the Hawaii Health, Hawaii Health Data Warehouse. Some of you are probably familiar with that. If somebody has that website and they want to throw it in the chat box for me, that would be great. That's the Hawaii Health Data Warehouse. You can find all these indicators for the state. So here's our high school binge drinking broken down by counties. So we could see that technically we have really statistically insignificant differences between maybe all 4 counties. It looks like Kauai County might be the highest, but statistically speaking, we're about in the same range in terms of confidence intervals. Sorry about that. So now let's just shift a little bit to what does alcohol use look like for our adult population. So unfortunately, the bar color is switched here. The blue is the US as compared to the orange, which is Hawaii. We see that our current use of adults drinking alcohol is just slightly under the national average, coming in at 52% as compared to 54.1%. But a little bit concerning is that our binge drinking and our heavy use rates are higher. So again, binge drinking for us is 18.7 as compared to 16.8 in the US. And heavy use, which is classified as 14 drinks a week for men and 7 for women. So basically going above the daily intake, which is no more than 2 drinks for men and no more than 1 drink for a woman. We're a little bit on the high side as compared to the rest of the US. These to me are concerning because again, heavy use is more associated and has higher risk with heavier consequences. Ultimately, what we're looking to do in our community is we want to reduce the burden of alcohol in our community by reducing the consequences. So let's talk about now what the landscape of alcohol looks like during COVID and how that's changed in our community. So the World Health Organization advice, and they're pretty reputable organization, I think, is to minimize your alcohol consumption, particularly during COVID, because your body's immune system makes you more susceptible to COVID-19. I don't know the science enough to really go into detail about this, but alcohol plays a role in our respiratory system and makes you more susceptible to disease and infection. And so the World Health Organization really is discouraging us from drinking during this time. However, there have been some new studies that have come out recently around alcohol consumption during COVID. Unfortunately, we don't have any state-specific data yet. We don't have any for young people, and we don't have any for adults. I did check with our state epidemiological work group, and they just don't have that information yet. But we do have some national data that's coming in now in national studies. This first one here is a RAND study. This one is, I believe, a representative sample of the United States. They looked at consumption during a period there in April to June of 19, as compared to May, a few weeks here from May to June in 2020. And what they found was that drinking increased by 14% across the general population of adults, with 3 out of 4 adults consuming 1 more drink a day. That may not seem like a lot in those terms, but when you think about 52% of the population, or 54% in the US are current drinkers. Now 3 out of 4 of those are drinking 1 more drink a day. That adds up to 1 more drink a month. That adds up to a lot more drinking. More concerning probably is this other indicator, or this other data point, which is that 41% of women have increased their heavy drinking use, basically. And so what we're seeing is that women are going beyond the 1 drink a day, or at least what the study is saying is 41% of current women that are drinking are now drinking more than the recommended amount. A couple of other studies: RTI survey, Kelton Global, We Connect Health survey. These were, I believe, non-representative samples, if I'm not mistaken, but they still both show that there's an increase in alcohol consumption during COVID. There's a few other ones. So if you were to go and search alcohol consumption during COVID, or alcohol consumption study during COVID, you'll be able to find a number of other studies as well. So aside from consumption and the fact that it seems like it's increasing during COVID, let's talk about how our kind of alcohol environment or alcohol landscape has changed. And so this is just a little slide here of various newspaper clips from throughout the country around how the alcohol availability is essentially changing in our community. And so we see here things like to-go alcohol might still be available in Florida even after the coronavirus pandemic. Cheers, Ohio to allow 2 alcohol drinks per meal for carry-out delivery during coronavirus pandemic. Alaska Alcohol Board approves beer and wine deliveries. Here's one down here from Texas. Governor Abbott, alcohol to go could stay forever in Texas. So just a little bit of a backstory of how this happened. When we were hit with the stay-at-home orders back in March, April time, a lot of the states started rolling out these emergency orders that suddenly kind of allowed delivery of alcohol and takeout or carry out of cocktails from restaurants and bars. And what we in the prevention field knew was that this basically became a great opportunity for the alcohol industry to kind of seize the moment of the lockdown, kind of frame it as, restaurants are struggling and therefore, we need to find ways to make money. But what we in the field really believe is happening is this is the alcohol industry's way to basically be increasing the availability in an Amazon type of style of, from my phone to my door delivery of alcohol. And so we'll talk about why there are some public health dangers in that. But before we do that, let's talk about Hawaii. What happened here? So I don't know how many of you know this, but we actually were one of the states that kind of followed in suit with this. So Governor Ige had announced an emergency order, and we currently have, to my knowledge, we have takeout and delivery in every single county. And here are just some news clips that I have. This was kind of a fun one. I was involved in this. Home delivery takeout of liquor approved. Many testifiers, though, have concerns. So a number of us from our coalition locally showed up to talk about the potential dangers of this, and we're actually pushing back on this because one of the issues is that while these emergency rules rolled out, there weren't very clear rules about how they were going to be enforced, how they were going to be done and implemented in each of the counties. So here's a bit of the timeline that we experienced in Hawaii around this delivery and takeout. So I think it was April 17th, Governor Ige announces the executive order, I think it was 20-04, if I'm not mistaken, allowing the county level liquor commissions to approve alcohol delivery and takeout. So we have a very localized liquor control here in our state, which is different than most states. Most states have state control. So basically, Governor Ige gave all of the local counties the ability to allow them to do alcohol delivery and takeout. The problem from a public health perspective was that well, first of all, it greatly expands availability, and we'll talk about that. But the rules vary extensively from county to county. So for example, in Maui County, where we were, and one of the things that we argued is, well, what kind of size of a drink can somebody pull up in their car and put in their car? What does sealed container mean? Does that mean factory sealed? Could somebody put a margarita in a cup and drive away with a margarita right next to them in their cup holder? And so they were scrambling and getting pressure from the alcohol industry to hurry up and pass these rules because they were framing it as we're suffering, and clearly they were suffering. But clearly alcohol was, some alcohol sales were not going to save their business, but they were trying to get this through. And so what Maui County ended up with was a sealed container can literally be a paper cup with a lid. And so someone could put beer in a paper cup, put a plastic lid on it, or put a margarita in there, or a Jack and Coke. You could grab it in your car and you could go. And so, some of what we talked about was, well, geez, there could be potential for open container issues. And, are people really going to wait to drink their melted mixed cocktail by the time they get home? So there were a lot of questions that we had around this. And there were other rules that just were not clear, like what kind of size can you deliver to a person, and what kind of size of a drink can you have? A 40 ounce? Could you do can you do a large just a large drink that you're carrying in your car and things like this? So there are some kind of public health concerns we had about that. The other thing was that in Maui County, and I only know Maui County because I followed them the closest, is there were no server education rules. Those were waived. And so what that means is that the local restaurants and bars are able, and they waived it because of COVID, are able to hire people to deliver alcohol without any prior training. So in theory, I could, an 18-year-old technically can usually serve alcohol in a restaurant, or I could show up and say, well, I want to deliver for you folks. And I could be delivering without any knowledge about carding folks and making sure people are 21, how to handle liquor, nothing. So I had no prior training was needed. So you could see where there's a slippery slope here. So what does that do to our environment and our norms? Well, it begins to make alcohol delivery and carry out seem normalized. And this really is why many of us in the field feel like the alcohol industry has taken advantage of this, because as you notice from those news clips from the national side of things, is that a lot of communities and a lot of states are saying, you know what, let's just make this permanent. And there's a hard alcohol lobby that are really working behind the scenes to make that happen in all of our states. We're concerned about it even here in Hawaii, that this could become a permanent rule. And there's lots of kind of risks to that in terms of delivery, where young people might be. What happens if you show up and there's a party going on and they're underage? Are you going to say no to them? What kind of danger does that mean? You put the delivery driver in. We have people delivering that don't have any education in alcohol service. What do you do if you show up and somebody is very intoxicated? Are you required to give them alcohol because they're in their home? There's all kinds of different things that we haven't worked through in terms of really making sure that this law is protective of our people. Let's see if there's anything else I want to say. There is a current bill, I did put this in here, going through the state ledge now, that we are opposing, which is around direct shipping of beer and liquor. And I say we as our stance is opposing, because of the fact that we see this as, again, an erosion of this rule. And this is one kind of avenue where they eventually want to go and be able to do kind of the direct phone app to door delivery of alcohol. So again, if you have any questions as I'm going through this, please throw them in the Q&A box. If you have any other comments about this, please feel free to throw them in the chat box. We'd love to hear your thoughts on this. So I've been talking a little bit about this, but what are some of the public health implications and risks when we increase alcohol availability in our community? From the World Health perspective, their data suggests that increased availability leads to increased violence. There's particularly some new research. Well, it's not new, but there's some research out there that says a shift when you go from on-premise, like drinking at a bar or restaurant, to drinking in the home actually increases violence in communities because of the unsupervised drinking nature that occurs now. You're in the privacy of your home, and so people act differently than they do if they're out at a restaurant drinking. This is a concern I've heard from a number of colleagues in the mental health field, in the schools, but this idea that there's a lot of alcohol consumption that is likely increasing in Hawaii. We don't necessarily have that data yet, but I think anecdotally we believe that it's probably increasing in terms of adult consumption. And this is going to increase the risk of child abuse. People are now home with their kids more. They're stressed because of COVID. And at the same time, the usual reporters of child abuse, like teachers, coaches, maybe clergy and churches, have little to no contact with these children anymore. And so I know that there's concerns in those fields of the social services and child welfare where there's concerns around this and what this is going to look like and how we're going to come out of this pandemic and what might be happening to young people and how this could be putting young people at risk. Worldwide, 63% of violent injuries in ERs involve alcohol. So, when we increase availability and we increase consumption, we're going to see increased alcohol-related harms in our community. Availability is also increases youth availability and accessibility in our community. You could see where this could happen with delivery apps. California did a compliance check where they ordered 400 home deliveries to homes. This was done by their enforcement agency, and 83% of those failed and sold or delivered the alcohol to minors out of the 400. And so this is a problem, right? And kids are smart; they're going to catch on to this. According to the CDC, our current burden of alcohol is almost $1 billion. It's about $973 million a year. It's a little bit dated. It was 2010. It could actually be more expensive now. They haven't done one of these studies in a while because they're fairly expensive and difficult to do, but I would think that we're probably at least at that number. So as we increase, again, consumption, we increase harms. This is costing our state, and it's also costing lives and injury in our community. So let's shift here and talk about what we would consider what would be a public health approach to reducing these harms in our community and looking at being able to reduce consumption as well. So I just have a little group activity, and I'm going to ask you to use the chat. I'm going to try this. So I'm going to ask for your help here, and this is how it works. And this will help us kind of conceptualize the public health approach to prevention, hopefully. All right, so I'm going to give you all the powers to be the new executives for McDonald's, and you have an endless supply of money, and you have no ethical obligations or principles that you have to follow in the community, and you just have one goal. And your new goal is that you're going to get everybody in the US to eat McDonald's 3 times a day, 7 days a week. So you're going to get everybody to eat McDonald's 3 times a day, 7 days a week, no budget and no ethics, okay? I want to know, and you can use the chat box, you can put yes or no. Do you think that all of you together could come up with 20 ideas in 60 seconds? Yes or no, use the chat box. Do you think you could do? I'm challenging you. All right, so I have I have Linda Kim saying yes. All right, Linda. All right, Colette. Thank you, Colette. It's nice to see you on here, Colette. I think that's the Colette I know. All right. Carrie. Oh, Carrie says no. I wonder if this is Carrie Bennis. All right, Dustin's in. All right, thanks, Dustin. So I'm a sociopath. All right, this is only a game. This is just a game. All right, I'm gonna go with yes. All right, so let's just see here. I'm gonna start my, let me get my clock together. All right, so this is no shame, and it's and again, there's no ethics, there's no shaming here. You're gonna come up with, it's about quantity, not quality. You're gonna come up with as many ideas as you can think of in a minute, and let's see if you hit 20, to make people eat McDonald's. Everyone in the US, they got to eat McDonald's three times a day, 7 days a week. You ready? Go. Type
And this
away,
is
put them in the chat box.
Sorry, this is Steph just jumping in. If you want to change your settings on the chat box to panelists and attendees, if you're able to, then other people can see your answers and not just us. But that's just
thanks,
your
Steph.
preference. Yeah.
Oh yeah, so if you feel really naughty, you can just send it to me. And we won't tell anybody. All right, so we got 1, 2, 3, 4. You got 25 seconds left. Free fries, I love it. All right, here we come. 10, 9, keep typing. 8, 7, 6, 5, 4, 3, 2, 1. All right, stop. You can hit return if you got one already there. All right, let's go up and see here real quick. Well, I think you hit 20 because I'm scrolling quite a bit. All right, so the first one, we got a family meal for $10, enough food to feed 4. All right, so you're making it cheap. Pay people to eat there. You're not only making it cheap, you're gonna pay people to pay. All right, that's 2. Give it away for free. All right, that's 3. Got another one for free. Use cocaine in the soda like they used to. Make everything really addictive. I love it, Pamela. Thank you. All right, so that's 4. Lay says 2-for-1 deals. All right, that's 5. Buy a large drink and get a free meal. Perfect. Thank you, Kristen. Oh, this is probably Kristen Wells. Thanks, Kristen. That's 6. Let's see. Provide free home delivery. All right, home delivery. Exactly. So that's 7. Cheapest meals you can buy for your family. All right, we'll make that 8. Add an addictive drug. All right, we got that one. Thanks, Jacob. Jacob, you're so naughty. I didn't know this about you. Let's see, shut down all other grocery stores and restaurants. All right, that's right. Shut them down or buy them out, something. All right, that's 9. Pay people. I think we said that. Well, let's make it 10. Set up a meal plan like college or link up with Snap. Oh, nice. You can only buy McDonald's if you have the Snap benefit is all McDonald's. Okay, that's so wrong, but yes. Okay, 11. Free fries for children. Why not? My kid loves fries. It's 12. Pay the lawmakers to pass the law. Love it. That's 13. Free delivery. We heard that one. Reduce the price. All right, we'll give you another one for those 2. 14. Do bingo game. 15. Free giveaways. Replace school meals. All right. So now Dustin we're gonna just have McDonald's at school. Nothing else. All right. That's like 17 or 18. Toys with all meals. 19. All right, you hit it. Let's just see what else there is here. You hit 20 for sure. Lie about nutritional value. Say it's very healthy, or like the alcohol industry does, don't put nutritional value on the labels. Don't have them on your bottles. You ever notice that? There's a lot of bottles that don't have any nutritional labels on them. That's on purpose, by the way. Happy Meal toy, free Starbucks. Everybody loves Starbucks, right? Provide transportation. All right, Lay's picking everybody up in her van or her bus. They hit it on their app, and here she comes. And then I thought there was no shame, Jacob. Yes, of course, there's no shame. I just wanted to pick on you, Jacob. All right, so round of applause. Good job. You definitely hit over 20. All right, so yes, this is how you would change behavior. You would base, and what this is getting at is from a public health approach. I can say that you're all well aware and adept and like experts at a public health approach to change, because everything that you did was around changing the environment in which McDonald's would exist for people. So young people would show up at schools, they would have McDonald's. You would be paying lawmakers to write laws that would be McDonald's only types of laws. You would buy out every other fast food restaurant and store. That would be your only option. So you would actually make McDonald's, again, back to availability, as available as possible to where people would run into McDonald's at almost any time in their life, right? That's kind of what you're creating. So a round of applause for that. That's exactly what we're getting at. What's the popular belief, though, around prevention? The popular belief is if we just educate our youth and families about the risks of alcohol, they will drink responsibly and there won't be any problems. We just have to educate our parents about the harms. We have to educate kids about the harms of drinking and they'll just stop. Is that true or false? I hope you can see from the activity that that would be false, because I want to point out that there were like 30 something plus responses in that minute. And not one of you said you would do a McDonald's education class at school or that you would pass out flyers. Nobody was doing a sign waving event to encourage people to eat McDonald's. But when we think about prevention and substance use prevention, particularly, we think, gosh, if we just get out there and educate kids enough, it will change. Will change that, and it might change. It might change for that individual. And so I don't want to discredit education, but education alone is not strong enough from what the data suggests and what research, hundreds of research papers and studies suggest, because of the alcohol environment. It's about the environment. So we're up against a multi-billion-dollar industry who does exactly what you are, what you explained. Some of those things they do talk to lawmakers to make it cheaper. Did you know that the feds this year passed a law? It hasn't been since, I think it hasn't been since 85 years. They actually reduced the amount of taxes that the alcohol industry has to pay on federal taxes on alcohol. Why would they do that in a budget crisis, in a budget deficit? They do it because they pay lawmakers to do it. They're doing this. They're doing this under our noses, right? Why is it that they have delivery? Well, for the same reason that you suggested delivery of McDonald's, right? Why is it that like you have free fries in school or McDonald's in school? Why is it now that we see on our shelves at the store so many fruity drinks that are very similar to what young people like and young people drink? Is that an accident? Well, we in the field think not. So let's just get rid of this and let's begin to know that, yes, should we educate families and parents? Yes, we should definitely educate them. Is that enough? It's just not strong enough because the alcohol environment in which we live is so normalized. And it's at almost every corner, maybe literally at every corner, right? And so for some young people anyways, and for some adults. And so what we need to do is also be including and say, yes, education is important. And if we're going to make a difference here, we need to change the environment to make the healthy choice an easier choice, instead of the unhealthy choice of drinking the default choice that maybe some communities find themselves in now. So a public health approach takes into this environment consideration, which all of you in your answers were getting at. You were getting at environmental things. You were going to make it more available. You were going to reduce competition. You were going to make it cheaper. And we're going to talk a little about that. So this public health approach to prevention has kind of these three parts. That is the host, agent, and environment. And the public health and environmental approach includes the environment. So an individual approach, which is what I thought a number of years ago when I got into prevention, that was the only approach I knew. And this really focuses on changing the host or the individual. So the host in this example of substance use, you could think of the young person or the adult that maybe is in the community, or ourselves, right? And the focus is on helping the host make better decisions and healthier decisions, and trying to change their perceptions so that we can change their behaviors. And that's good to do. But the environmental approach to prevention focuses on this environment and on the agent. And the agent in this case is going to be alcohol. Alcohol impacts our host, but our environment has a lot to do with that. So the more we have alcohol in the environment and the more available it is and the cheaper it is and the easier it is to access, the more the host is going to be interacting with that agent. It's the same way with COVID, right? What we are doing right now in COVID is a public health approach. If COVID is our agent and we're the host, we're trying to create environments where the host can't exist. or the agent can't exist, right? Maybe we can't exist either. It's been so long, but the social distance, the mask, this is about changing our environment in which the agent exists. So here's just a little bit of some differences, and I just kind of want to point them out briefly, but I think they're important. When we think about individual prevention strategies, again, we're really focused on behavior change in the individual. An environment, we're focused on policy change. Like that one person said, pay the lawmakers to change the laws. We're really focused on how do we change policy, because that changes the environment, it changes for everyone. In individual strategies, we're focused on the relationship between the individual and drug-related problems. So this might be perceptions, it might be helping individuals refuse using drugs and things like that. But in environmental approaches, we're focused on the context of drugs and alcohol. Like, why is it, I was talking to a colleague of mine in Florida the other week, and she said they did a mapping experiment where they overlaid alcohol outlets, basically restaurants and stores and bars that sold alcohol. They put dots over like a map in their town. And you had the wealthy town on the one side, and you had the lower income town on the other side. And she said on the lower income side, when we dropped dots down to see where all the alcohol was available, she said there was like no land. You couldn't see any land in the low income side. But you saw all kinds of land on the high income side, right? And so there's an overabundance of availability in the low income and not as much in the higher income. So when we're looking at environmental strategies, we're looking at and we're asking the questions of why is that, and how is it that that's not by accident, right? And how and that does impact those communities. And it gets us beyond this idea that somehow people make poor choices and gosh, you just need to make a better choice. But when you begin to look at it that way, it's really clear and easy to see that it becomes more than just a choice. Because if every block you have to go by a liquor store that's promoting alcohol or has marketing up for young people or sells to young people or whatever that might be, there's more likelihood that you're going to drink. It's just the way it is. They know that. Individual strategies focus on this kind of program development. So usually it's around an education program. Environmental strategies focus on long-term policy development. We were trying to pass an alcohol excise increase tax bill here in our state with our statewide alliance, and we just got killed this past week by the alcohol industry. And they just did some backdoor deals and got the bills killed. But you know what? That's okay. We're gonna regroup. We're gonna really reorganize for this next year, and we're going to go into it next year. So it's really the long-term focus of, we didn't get it this year, we're not going to give up. We're going to re-strategize. We're going to get more partners. We're going to build more community support for this, and we'll go for it next year. And individual strategies, individual is usually not participating in the decision-making. This isn't always the case, but in environmental prevention, really you're looking at the people power, just what I was talking about. We're looking at organizing individuals so that they have a say in this, and that they're the ones out doing the action. Individuals are the audience usually in individual strategies, because it's usually maybe a presenter that might be presenting a course or at a tabling event and telling you about their information. Whereas in environmental prevention, the individual is seen as an advocate, and we're trying to train individuals to be advocates in the cause. So Frieden's pyramid, this is a little bit complex, and I'm running out of a little bit of time here, but let me just try to summarize this really quickly. Frieden, I think, was a former director for CDC, I believe. And basically what it says, there's various factors in our community that impact health. And it kind of goes from the smaller point at the top and moves to what we would call kind of larger socioeconomic factors. And so at the very top is kind of our smallest impact. So if you think about, if you're doing education in schools or you're doing education with families, you might hit 500 or 1,000 young people in 1 year in your county, let's say. But on the grand scheme of the number of young people in that community, it's probably a small percent. As opposed to socioeconomic factors, when we're changing context within our community, that's kind of where we're hitting everyone in the community. So it doesn't matter if you attended this course around drinking, because basically what we've done now is we've created some outlet density restrictions in the community, and we're not going to allow any more alcohol density, any more alcohol outlets to move in this community. That's going to change the context of our community, whether you think drinking, whether you decide to drink or not, right? And so what we move from is basically small to large impact, but what's not on here, which is also as important, is we move from little political will to a lot of political will. And that's why it becomes difficult as you get down here in these rungs to really make change, is because it takes a lot of political will to make change. This is just the example of alcohol. So if you think about it from an individual prevention focus, evidence-based kind of interventions lie more in this area. This could be your life skills or positive action, classroom-based things, family-based activities, after-school things. And where environmental prevention usually lies is right around in this area of the context. So we're thinking about, how do we change this alcohol environment? How do we change the context in which alcohol exists in our community? So we look at things like increasing alcohol taxes, reducing alcohol outlets, reducing what's called social hosting, where parents allow parties to happen in the community where underage drinking occurs. But again, as you move down here, and the reason it's hard to do these and the focus is long-term policy, it's because there's more political will needed. This is usually ordinances and laws that require lawmakers and decision makers to weigh in on them and take more time. And they just take more, like I said, political will. But what we do know is they have a larger impact. So whereas down here, if I simply if we were to increase the alcohol tax, we simply make it harder for young people to buy alcohol. As opposed to up here, it's easy to do these, and we tell young people to resist alcohol. But if the context is changing and making it cheaper, and we've got more fruity drinks on the market, it's only probably a matter of time where, like the McDonald's activity, there's so much of it in the environment, it's so easy for them to get, they're likely to be drinking. This is just another way to kind of hopefully hit the message home. And that is, if we were to think of these cute little sea turtles and they got sick on us, would we blame sea turtles for getting sick and think, gosh, well, you probably just made a wrong decision there. You probably should have decided not to eat that plastic. I wish I would have been able to teach you that, but poor you made a bad decision. Or would we think about the environment, right? So if we had young sea turtles that were getting sick, would we say, I wonder what's happening in our environment? Clearly, we would do that with sea turtles. I think the message I want to hit home here is we need to be thinking that with our community as well. We need to think about that with our young people as well as our adults, that it's not just about a poor decision to drink alcohol, but it's about looking at the environment in which alcohol exists and thinking about how can we make this environment safer so that they can make choices that are easier to make. I'm just going to skip this one. Again, it's about context. This is when we think about environment, we're talking about addressing context. Context is those places, settings, occasions where alcohol or drug use occurs. Sometimes I like to use this lingo because it works with people, this idea of built environment. So we've created a built environment in which alcohol exists in our community. This lingo we often use for transportation, we use for food access. So you can think about alcohol in the same way. What we allow the alcohol industry to do and how we allow it to interact with our community is the built environment we create. Kind of 4 elements to the environment when we talk about the context of alcohol in our community, and that we call it the 4 Ps. It's price, promotion, product, and place or availability. So I'm gonna run through. I just want you to see kind of how McDonald's does it and how the alcohol industry does it, and then what we could be doing about it. So here's a good example of McDonald's. So if we just go back for a minute and look at these, price, these are the elements, and this is what companies and corporations also use, by the way, to market their products. So we use this in prevention. So the price of a commodity, the way in which it's promoted, how the product is viewed in the community, the type of product it is, and how available are the places we can find it in our community. So if you just look at McDonald's, they're a great example of this. So you think about price. They have great promotions like this to get you in the door. Buy one, get one for $1. That's amazing, right? I just want to, I mean, I've done this deal before. I've seen it in the windows and it's literally got me to go to McDonald's. So their price, they have a price point that gets people in. They probably actually don't make any money off that burger. In fact, they probably eat the money on that burger. But what they know is you're not just coming for that $2 burger. You're gonna order, some chicken nuggets for your kid and some French fries. It's called a loss leader, right? And so they purposely make a product cheap to get you in the door. We see this with alcohol as well. How a product is kind of promoted and accepted in the community. So here, we've got the local breakfast platters. Place, where can we find McDonald's? Well, the last I looked, there's 13,905 stores nationwide. So you can find it at almost every other corner. And how they promote themselves. So you could probably show any 5-year-old this arch and they're going to know exactly what that is. That's how good their promotion and their branding is, right? And what was the other P? Did we miss a P there? Price, product, place, promotion. I think we got it all. This is just an example of how McDonald's uses this and leverages this to sell their product. So let's take a few minutes and look at alcohol and how they do this. So the first one is around product. Products are made now. I should back up. When I was growing up, and I'm old, but not that old, we had the kind of the first fruity drink of Zima. And we have wine coolers, I guess you could say, but Zima was the first thing that came on the market when I was a bit younger. And this was really what we called a transition drink. It was kind of the beginning of what we know now as a huge market for transition drinks. And these are drinks that are made to be easily drinkable, and they're made to transition people from drinking non-alcoholic drinks to alcoholic drinks. And so we have just a booming market of this right now, but it's an intentional booming market for them because it's around getting new customers transitioned again from those non-alcoholic drinks to alcoholic drinks. So if you think about vodka is a great example of a product that was it was a dying product. Only old people really drank vodka. Sved vodka and what was the other one? What's the red one? Somebody knows what that's called. I just forgot it for now. But the red label, Smirnoff. They were really losing their customer base, right? Because they were an aging old base. When transition drinks occurred, this actually sent their profits back through the roof, particularly Smirnoff. Smirnoff came up with Smirnoff Ice. Smirnoff Ice is now the most popular drink of underage drinking girls in the country. At least it was as of a few years ago. It probably is or is very close to the top because it's very easy to drink. And so we have products like this, like strawberry lemonade vodka, mango pineapple vodka. And I just want to note a few things. So strawberry lemonade vodka and mango pineapple vodka is probably not targeting people in their 40s or 50s, right? And certainly the color of the product. So again, this goes to promotion. What age group would this be targeting? What age group does kind of urban camo target, right? I don't see a lot of 60, 70-year-olds wearing camouflage or hot colors, but I do know of an age group that does wear a lot of those colors. Again, the new seltzer water that's been out now on the market for maybe only 2 years, it's just been booming. In fact, you got to be really careful around young people and little children because from what I know, they taste almost like a non-alcoholic drink, essentially. So again, another example here by accident or design. So one of the ways the alcohol industry tries to normalize drinking is to make it look the same, right? And so on the right here, you have new Capri Sun packages, and you have Cordina kind of margarita mixed drink packages. Is this by design, or was just maybe a coincidence that this happened? We believe in the field and particularly know that this is not by accident, that if we can get, again, think about the environment, right? If we can get a young person drinking a Capri Sun and we have an adult drinking something that looks just like it, well, mommy and daddy, I want to drink yours. And it's easy then for them to identify with alcohol that mom and dad is drinking, as this is now like my alcohol. These are ways that shift our behavior and change our norms in our community. Again, this just goes to point out kind of the way in which products are promoted and designed. It's really hard here to tell which of these products are alcoholic and which are non-alcoholic, again, by design. And then promotion. So if we think about you probably never now go through a store the same. And I would encourage you, if you go to Safeway or Foodland or wherever you shop next time, go and look at all of the alcohol promotions and what we call pyramids or big promotional stands. And you'll probably notice a lot of these. So this is just my local Safeway that I took pictures in. And you can see here that in order to get to bread, to get back to where the birthday cakes and the pastries are, there's just almost at every side of you have to be exposed to alcohol. And this is interesting too, and this is maybe purposefully, it's at every level. So that's really important. So you think about a candy stand in the grocery store, the candy stand is usually at an adult's maybe chest down, and that's purposefully done so that young people are in line of sight for that. And so here you have line of sight for young and old. It's another example of kind of placement and how things are placed in grocery stores and other places in our community. Here you have kind of a framed Corona display with cases kind of 5-6 feet high. But then in here you have kind of toaster strudels and youth sensitive types of products. Here's more promotions. Again, this is just me going into stores and taking pictures. This was the most recent one. It was, and my 2-year-old actually asked for it because he saw the candy cane, but this is Fireball filled, candy cane tubes, and they've got little, airplane shots of Fireball in it. And they're at kind of a lower level. So he was actually able to grab one. And he told me he wanted it. Again, pairing things that are mostly associated with young people like bears and things with alcohol, surfboards. You'll see a lot of these at the front of stores, kind of these beer pyramids or alcohol pyramids. A lot of times they're what they call loss leaders. So they put a really cheap price on those at the front of the store to get you in the store. They actually lose money on that, but they believe that by the time you pick that, Target does this very well. They put that really cheap bottles of wine right out in the front. They're $4.99 to, I don't think they're above $7.99. And that's called a loss leader. So they're not making any money off that. In fact, they might be eating 50 cents or $1 off every one of those, but they know by the time you grab that and try to get to the cash register, you're more likely to go in and buy more things. Also, it's theft sensitive in those spots because it's easy for young people to go in and grab and walk out really quickly. I've actually witnessed it before. Again, here's some other ways in which the industry normalizes the environment of drinking in our community. And so, as I'm sure all of you know, Heineken has been kind of at the front of this. Budweiser's tried, not as successful as Heineken, to really look at how do they identify with the culture and the green bottle identity with being local and drinking alcohol. These are just some advertisements where that's the purpose of this. The purpose is to have brand loyalty. And if you're local, this is what you should be drinking. And I love how they take liberties to make their own Hawaiian flag. And this has nothing to do with anything with alcohol. In fact, I saw this, I was a little disturbed. I think King Kamehameha would have a different view of how alcohol has impacted his people. I don't think he would be as positive as Heineken's being right here. And place. So another thing about our environment is how many places do we allow drinking to occur, or where do we turn a blind eye where drinking might be occurring, where it's dangerous for young people and adults. And so, flotilla happens. I don't know if it still happens or will happen post-COVID, but where, do we allow young people in our community to drink at house parties and barbecues, or do we allow beaches where things can get out of control, where people are drinking a bunch and people are playing in the water and doing things that are potentially harmful? Do we allow those types of settings in our communities? Just another consideration as we look at the environment. These are important aspects of the environment. Again, place, here's kind of this is what I was talking about in the previous a few slides about my colleague. This is a map overlay of places to get alcohol at retail establishments and bars. But now what's interesting is with delivery, this really actually could be anywhere, right? And so if you're, for example, living over here somewhere in, I don't know, here in Kahala, you have to literally go buy alcohol. You might not buy alcohol if you run out. But now that you have delivery, you essentially have it at your doorstep whenever you want. And so it really does encourage more drinking and easier drinking. So, all right, so giving you some bad news maybe and what we're up against, but what can we do about it? So let's just start with some things, and this goes back to our McDonald's activity. Let's talk about what doesn't work, at least in isolation. And this is, again, just to debunk the common myth that I had to when I first got in this field, that education was the main way in which we were going to change community level behaviors. What we know is that education alone doesn't work in isolation. You need to have education with environment, with strategies that are going to address the environment. So just some things on here and some data from some studies and resources, mass media campaigns. So this is interesting. And they did, it was a lot of campaigns that this study included. I think it was over 100 different campaigns, mass media campaigns around the country. Persuasive campaigns, in other words, if there's just a campaign that says you shouldn't drink, you should drink less, alcohol is bad for you or something like that, try to persuade people to drink less. The short-term effect is 5% at best. You get a 17% effect if you've got a legal enforceable behavior. So this goes to the environment piece. So if you, for example, and one of the things we did here recently with some of the help of folks on this training call is we passed what's called a local social host ordinance, which holds adults responsible if they allow underage kids that aren't theirs to drink in their home. So if they throw an underage drinking house party and police show up, they can get cited for a fine for that. So what this would kind of say is if you did a promotion out there or a mass media campaign that said adults don't provide alcohol to minors in your homes, you might get, if you did a really good job of getting it out there, you might get a 5% short-term effect. But if you said, don't provide alcohol to minors in your homes, and if you do, there's an ordinance that you could be fined $200, that would have a more, not a more lasting effect, but it would have a more positive effect of around 17%. You know, you can't say it's 17% on one study, but that's nationwide. But it gets to the point that when you tie media and education with a policy, you get a more lasting impact. It's the same if you think about drinking and driving. If we simply said don't drink and drive and we had no laws, you're going to get almost no impact there. As opposed to you say don't drink and drive, and the one that we have now down, a sign that's flashing down the highway from us is, you know, if you get hammered, what is it? Something like get hammered, get nailed or something like that. I thought it was kind of clever, right? But what they're saying is if you drink and drive and you get pulled over, you're gonna pay for that. That has more of an effect. So there's just a little bit more. One of the things that is positive around media campaigns is that they can, what we say here is soften the ground. So they can bring awareness to the community about the issue at large, and kind of soften the ground so people know that this is an important issue in the community. And that can be really helpful in laying some of that environmental strategy work that other communities or that a coalition or individuals might come and do on top of that. So that's really important to remember. And so if you're out there, I was out there with some folks sign waving a couple of weeks ago, some folks here that are in the room that put something on, and that stuff is great. So don't think that I'm discounting it or that the science is just discounting it. It's just saying that, again, I'm hammering it home to try to hopefully create some paradigm shift for you to know that education is important, but it's not the cure-all for our community when it comes to alcohol-related problems. So this is some guidance from the CDC. What we know is what we would call insufficient enough evidence. So CDC has some pretty strict standards in terms of what they would consider to be evidence-based strategies for reducing alcohol and harms in communities. So this is on their kind of insufficient evidence list right now. And it includes the one we just passed, social host liability. Some of my colleagues in the field have been working on getting enough evidence for the CDC to call it an evidence-based strategy. We put that probably in a promising practice right now, but it's a lot of work to do this, and the CDC does not kind of lower the bar for folks who are having a hard time with this. They really want the rigor to be there to say, if a community implements a strategy, they should, and they implement it well and with fidelity, they should see community level results. And so these just don't yet have enough evidence for the CDC to consider them an evidence-based strategy. So what does work? So these are the strategies that CDC recommends for communities that are trying to reduce excessive alcohol use, youth use, and injury related to alcohol use. Increasing alcohol taxes and we see this very well in tobacco. So if you think about the price of tobacco 10 or 20 years ago and what it is now, tobacco prevention has done a great job of increasing those taxes on tobacco. It simply prices people out, and those people who continue to smoke less. And so what you ultimately do is you reduce harm in the community over time. You reduce consumption. You reduce some people who just say it's too expensive, I'm not going to do it. And those that do it less. And so they're at less harm to themselves and the community. Dram shop liability. This is often called commercial host liability as well. This is where alcohol establishments can be held liable if they overserve folks and they're intoxicated. So I'm at a happy hour, or somebody's at a happy hour, and the bartender just keeps serving them because it's happy hour, and they keep drinking them, and they get in a car crash after they leave that establishment. If they trace it back to that bar, they could hold that bar liable for knowingly kind of over-serving that person. Regulation of outlet density. We talked a little bit about this. This is those dots on the map, right? So that communities who actually create regulations that have a maximum number of alcohol outlets in a community and don't allow them to just kind of pop up as many as they want, and they have rules around that, do have less alcohol use occurring in their community, and it reduces violence in the community. Screening and brief intervention. We see this most of the time through ER visits, doctor visits. It's sometimes referred to as ESPERT. This has evidence to show that it works. This is really getting people who are problem drinkers or excessive drinkers help needed and doing it quickly and identifying them quickly, not having to go through a long process, because you'll lose them if it's a long process and the time to respond and react to their need is slow. Enforcement of laws prohibiting sales to minors, that makes sense, and disallowing privatization of retail alcohol sales. That basically what privatization of retail sales is what we have here for the most part. And that is where the alcohol industry and private entities kind of own the alcohol landscape and the sales of it. So my hometown of Ohio, we still have what's called state liquor stores. So the state runs liquor that is beyond a certain proof. So let's say it's 80 proof and above. You can't buy it at a grocery store. And so it can't be sold by a private business. It's sold by the state. And that's good because the state then controls all the promotional material. So you're not going to go into a grocery store and see a Captain Morgan's sign up, because they're not going to sell Captain Morgan's there. They also control the price. They control the outlet density because they only allow a certain amount of stores within the community to sell the liquor. So if I want to, again, this goes to the availability. If I want to continue drinking, I might have to drive 10 miles down the road or 20 miles down the road to my local liquor store or my state store, as opposed to here where we kind of can sell liquor at gas stations. So this is just, again, a little bit of this is a graphic I pulled from their community guide. That's probably the best. That's where I pulled all this information. If you're looking for those strategies, those evidence-based strategies that the CDC has, if you look up the CDC community guide on alcohol, that's where I pulled all this data from. And these are the specific interventions and kind of their findings around whether they have evidence. This is the World Health Organization. Again, I'm kind of laying this in the evidence. So the World Health Organization has come up with this slogan for reducing alcohol-related harms across the world. It's called SAFER. So strengthening, the S is strengthening restrictions on availability. The A, advance and enforce drink driving countermeasures. So this is around driving and drinking, obviously. So when we enforce those and we create laws that enforce those and make sure we have them, we're safer. We're actually right now, our alliance is still trying to reduce the blood alcohol level at the state level this year for the BAC level to go from 0.08 to 0.05, which would make our roads a bit safer. Most Western countries have already gone to 0.05, but the US has not. The F, facilitate access to screening, brief intervention, and treatment. We talked about that. The CDC also has that as their evidence-based strategy, as an evidence-based strategy. E, enforce bans or comprehensive restrictions on advertising, sponsorship. And then R, raise prices of alcohol through excise taxes and pricing policy. So this is, again, it aligns very well with CDC, but again, I wanted to kind of ground it in the evidence that this is the World Health Organization's kind of worldwide strategy approach to reducing alcohol harms. So what's Hawaii doing? And let's talk a little about that. So if we were to have really what we would call a comprehensive prevention approach, and I'm happy to say we have that here. We can certainly strengthen it, but we have a comprehensive prevention approach. It really includes these kind of three prongs, if you will. And so we have individual prevention programs, environmental prevention programs, and kind of ongoing development of our workforce. So I wanted to name, and you're going to have to, I want to ask for an apology here. I'm sure I didn't get everyone here. But here are some that I know of. I tried to get a list beforehand. Again, I apologize if you're not on here and you're in this room, of some of the individual prevention programs that I know are happening around the state. Some of these you've probably heard of, and if you know of any other ones, by all means, click panelists and attendees on the chat box and put in some there. Bev, yeah, add some for me if you know of any on Kauai. I just didn't know any. I talked to a couple of colleagues and I didn't talk to anybody from Kauai in time. But if you know of any other ones, please throw them in there. So again, these are important. These individual prevention programs are important. We want to make sure we're doing those. We want to make sure we're sending messages to families and young people in our community at large around how to prevent drinking, the harms of drinking. A little shout out to Project Northland. Some of the folks are on here who do it here at MEO. And one of the cool things they do, which I really like, is they do kind of an education around the advertising of alcohol, kind of like what we just went through. They do that with the young people. And I think that is so important because it's so right in front of our faces, but we don't yet know it. It's just until you see it that way, you had no idea that they were, kind of promoting such practices or that it was so available in our stores. If you just walk into a grocery store, you could find probably over half of your aisles probably have end caps at the end of them. So you have the alcohol section, but then at the end of every aisle, they'll have or maybe not every aisle, maybe half of the aisles, they're going to have like a pyramid or an alcohol display there. So Project Northland does a great job of that. And so just shifting to kind of what do we do about our environment and what are some things that Hawaii is doing to promote kind of environmental strategies. And so we do have a number of coalitions. These are the ones that are currently kind of funded under some federal programs or the state that I know of. If you know other coalitions that are working on this stuff. Oh, Life's Choices. Thanks, Bev. Teresa Koki, guys. Thank you. She'd be so mad if she knew. She's not on this call. I don't think she'd be so mad if she knew I didn't include her. But here are some coalitions around the state that are working on these environmental strategies we talked about. The Maui Coalition, just again 2 weeks ago, we passed the local social host ordinance for the island. It's the first social host ordinance of its kind for the state. And our statewide alliance is currently working on. We were working on an increase in alcohol taxes this year. To help both with our budget shortfall. And it's been 23 years since we've raised the alcohol tax in our state. And so alcohol has essentially gotten cheaper year over year because of inflation for the alcohol industry. So they've been making more and more profit off of us. We currently have a BAC law there. I know Community Works 96744 is working on a social host law potentially in their community. And I know HPUD, Hawaii Partnerships to Prevent Underage Drinking, is working on a responsible beverage server training that would train everyone who's touching alcohol or serving alcohol how to properly do that. And thanks, Bev. Yes, she would be very, very upset. I agree. Don't tell her, please. Anyways, anybody know of any other coalitions out there, or any other kind of environmental strategies that folks are doing related to substance use? If you do, throw them in the chat box. I'd love to see what else might be out there that we're missing here. And then lastly, this third prong of statewide workforce development. This is just, again, a number of resources for us, but if this is something of interest to you, and for us that are in the field kind of working on this on a day-to-day basis, it's hard work. Whether you're doing individual prevention programs, or you're in the community trying to do environmental strategies, it's hard work. And I know, like, I see Colette on here. There's a number of folks like Colette who do this for the passion, and they volunteer their time well into the evening hours, hours and hours to do this work. And it's hard work. And so one of the things that's critically important is that we continue to be on the cutting edge of our field, that we continue to provide trainings like this to our community, and that we find those resources in our community that continue to be there for continual professional development. And so these are just some that I know that are out there. Again, if there are others, by all means, please let me know. And if you're in a county here and you're thinking to yourself, I like this kind of work, or I'm interested in getting to know more, I put the contact names of the folks in each of those counties that are overseeing their workforce prevention projects that the state currently funds. Another good resource is the Alcohol and Drug Abuse Division training calendar. Of course, it was kind of a long address here, but if you just type in, Hawaii Drug Abuse Division training calendar or something, it'll pop right up for you. Another one, the PRC. This is Drug Free Hawaii is the fiscal manager of this, but HIPRC808.org, and this is our kind of state prevention resource hub where you can find a lot of prevention resources there as well. I think this might be my last slide. So if this sounds remotely interesting to you, as it did to me almost 10 years ago, and I sat in a 2-day training and thought, oh, this is really interesting. I never knew it would take me to a place where I'm doing it full time now, and really kind of passionate and excited about the work. Look for opportunities to get involved. Participate. Thanks, Bev, for the Hinamauka one there, for the other programs. Participate in a local community coalition. So, find a coalition there on one of those pages. There's one in every county, at least. Look them up, see how you can get involved. Volunteer with a local prevention organization, Big Brothers, Big Sisters. I imagine a number of the organizations here take volunteers at some level. It can be tricky because you might not be able to directly volunteer with young people. You might be able to, but I'm sure they have opportunities, or there may be opportunities for you to volunteer some of your time for those as well. And they have a lot of community events, like that sign waving event that they put on where it was around safe driving during the Super Bowl. Show up at events like that, be a part of the community, be part of the solution. But join a statewide campaign. If you think this is interesting, shoot me an email. I got my email here at the end, or shoot me a chat at the end of this, and let me know you're interested in being part of our statewide alliance. We need community members to come out. We're up against a very powerful alcohol industry that in the middle of the night does some backdoor deals, and the only thing that we have to counter that is people power in our community. We certainly are never going to be able to raise as much money and be as kind of politically powerful money-wise as they are, but we have voters, and we have the constituents of our lawmakers. So if that's something that's interested you, by all means, get involved. Contact me. Continuing educating yourself, go to some more trainings like this, access some of these training resources and workforce development resources here on this slide. And last, if you don't have something in your community, start a coalition, or at least start a conversation. I came back from a from a 2-day conference on Oahu. I thought this was very interesting. And within a month, I and a couple of my colleagues had started a coalition. We didn't know what we were doing. I became a volunteer coordinator for the first couple of years of that coalition while we looked for funding. And that became the Maui Coalition. And so, who knows what could happen if it's something you're really excited and passionate about. And if that's something that you are passionate about and interested in, I'd be happy to talk to you about it. So with that, we've got about 9 minutes left. Steph, do you have anything to say?
No, just thank you. Thank you so much for an awesome presentation. I guess just a reminder to everyone, if you have any questions, we can kind of keep chatting while we wait. But if you do have any questions, please feel free to put them in the Q&A box or into the chat box. There is one comment, which I'll read off. So it says, it might be helpful to have more education or resources available about the judicial process for folks who get DUIs or OVUIIs, term I am not familiar with. So maybe you can tell me what that is, Rick.
Operating a vehicle under the influence.
Thank you.
Yeah.
If people knew how expensive, inconvenient, and time-consuming those were, they'd probably think twice about drinking and driving.
Yeah. Yeah, I agree with you, Brittany. Definitely is something that we could have more available. And most of the environmental strategies actually try to shift away from the judiciary system. So a good example of that was the one that we just passed, was our local social host ordinance. We were very adamant that a criminal citation. There were a lot of people, there was quite a bit of pushback to try and have it go criminal, because it was kind of like, it's what we always do. Police don't know how to enforce a civil code, but we really pushed back on that because of what you're talking about here, kind of how expensive, inconvenient it can be. We didn't want to plug up the court system, and we didn't want to criminalize a parents for doing this. It also takes too long to do. And so a lot of these strategies try to actually get away from that. With a DUI, you're probably not going to get away from that, but I do agree with you that, having more awareness out there, like those mass media campaign research was saying, if you do some campaigning out there, it's probably enough to create deterrence, because on the back end, our DUI laws here are pretty good. If you get pulled over, you're not going to sweet talk the police officer out of your DUI. Like, you're just automatically out of your car. You're not driving your car is impounded, you're coming to the station. That works really well in communities because of what's called the certainty that you're going to get, cited. So that can, just to your point, awareness campaigns in that respect can be really good, and oftentimes create enough deterrence in the community. Like, hey, you're going to get busted. Hey, did you know it's $1,000? Hey, did you know you're going to be whatever out of your license for 3 months or something? Can have an effect of enough deterrence that people don't drink and drive as much. I used to work for ADLRO. We hear the remorse all the time. Oh, okay. I'm not sure what that is. You could maybe help us with that acronym. But yeah, I think Brittany's getting at kind of how kind of maybe sorry folks feel after the fact. Oh, okay. Gosh, that's a tough job.
I'm just going to read it for the recording. I'm not sure that the chat pops up. So it's ADLRO stands for Administrative Driver's License Revocation Office.
Yep. Thanks, Steph.
Yeah. It seems like there aren't any questions, which means you did a wonderful presentation. But I guess before we wrap up, any last minute things you'd like to leave with the attendees?
No, if you're interested, just feel free to, I have my contact information on the slide deck and my phone number. Feel free to contact me if this is interesting to you or you want more information. Be happy to share with you. Thanks for having me, Steph and Maka. I really appreciate it. It's been fun.
Thank you so much, Rick.
Yeah.
So as I mentioned, just big mahalo to Rick for being our trainer today. Just a couple reminders. Thank you for your patience in working through some of the Moodle issues that we're all kind of learning as we go. But this training is recorded and will be available both on our YouTube channel as well as through Moodle. So we will get that link posted into Moodle by end of day today. I will also be putting the slides up in Moodle for you to access. You can download them, just log into your Moodle account, go back into your My Courses folder, click on today's event, and then they'll be available there. Just to go over the process again, awesome thing about Moodle is you're not waiting on me to send you the evaluation or your certificates. So once we end this webinar, you'll be able to go back to your Moodle account. You'll complete the assessment, the evaluation, and then once those are complete, you should have access to download your certificate of completion. If you have any questions, please feel free to reach out to me. I'm more than happy to help you. Again, mahalo to all of you for joining us today, and we hope to see you on a future webinar. Aloha.
Thank you, everyone.